Schreiber. We have been meeting doctors this morning here on Sunday Today. Most physicians tend the ill in their communities, and then there are those who see the broader world as part of their community. Sometimes it takes a seismic event to broaden those horizons. That is what happened with Neil Kahanovitz. He is a spinal surgeon practicing in Virginia, but then came the earthquake in Armenia, and his life changed. Ellen Fleischer of WNBC TV in New York tells his story.
The nerve root at S1 was then noted to be displaced posterior immediately by 2 fragments of sequestered disc material. The nerve root was attracted immediately and a fragment.
For spine surgeon Neil Kahanovitz, it is all part of the day's work.
Small one, please.
From a medical perspective, this is perhaps the most common of back operations, a herniated disc. The patient who came to this Alexandria, Virginia hospital unable to move will return to work 2 weeks after surgery, pain-free for the first time in years.
See how I'm under the root now?
Now, there may be some doctors for whom patient adoration, not to mention compensation, is the very essence of life.
Can I raise this leg?
Sure, you can raise it.
But not here. Perhaps because his medical point of view is so much larger.
Mr. Neil Kahanovitz.
It is unprecedented for an American to receive the USSR's highest honor, the Order of the Supreme Soviet. Ambassador Yuri Dubinin presented the medal for personal courage to Dr. Kahanovitz in the Soviet embassy in Washington a few weeks ago. A memorable moment for anyone, but especially for someone whose initial career plan never really included international relations.
The only 2 things that I can ever remember wanting to be ever was a circus performer and an orthopedic surgeon.
One could call it an unusual combination.
Between college and the beginning of medical school, I sold popcorn for the Clyde Beatty Circus, and it wasn't until very shortly after I began medical school that I began to perform as a clown, and then shortly after that, as a clown in a trampoline act.
He began working weekends under the name Neil K., but wound up traveling on the shrine circuit. Clowning had become so serious, he had to take a leave of absence from medical school.
Despite my parents' reservations, and certainly a lot of the people in the medical school, there was never any question in my mind that that was going to be my career. But
in the years since medical school, Dr. Kahanovitz has earned recognition as a surgeon, research scientist, and teacher, most recently with the Anderson Clinic in Arlington, Virginia.
You see that the sac of nerves right here.
15 months ago, a devastating earthquake hit Armenia. As many as 50,000 killed, 10,000 children orphaned. No one could count the injured. There were too many.
The size of it overwhelmed me, and at the time the Armenian earthquake happened, I was at a point in my career that I felt very comfortable with my abilities and knew that I could actually go over there and make a difference. Limbs were virtually just ripped off their bodies. They had crush injuries of their arms and legs, which rendered the limbs totally useless. And just the volume of destruction, human destruction, was awesome.
He contacted AmeriCares, the global medical relief organization. Bob McCauley, AmeriCare's founder, had heard about Neil Kahanovitz.
He's probably the best back surgeon, I would think, anywhere in the world.
A surgeon who shared McCauley's no-nonsense philosophy.
When you have a crisis, you don't call up and say, okay, we'll have a meeting at 9 o'clock tomorrow morning, we'll have one tomorrow night. Should we go? Should we not go? We have boats and stuff. That's not a crap. We just got the airplanes, we got the dough, we got the medicines, and go out to the airport and get on.
The medical care often taken for granted here is not universal. Some earthquake victims were worse off after evacuation when they underwent surgery in Moscow and Kiev.
So at that point, my real thrust was to see if we couldn't get the worst of these patients back to the United States.
Among the injured brought here was Lubov Papikian, mother of 4. So serious was her spinal fracture, she thought she would never walk again. Dr. Kahanovitz operated. By the spring, Lubov was ready to go home. Armand Kazarian arrived dazed and unable to walk. His mother, brothers, and sisters were dead. He was the only one in his school to come out alive. Quite a burden for one 9-year-old, which may help explain why Armand, upon arrival in New York, was also unable to speak.
Unfortunately, we can treat the spine, but the spine is only part of the whole problem.
Still, Armand's surgeon was determined to see him walk again. 6 weeks later, we strolled a hospital corridor, Armand aided by a leg brace. His voice had returned, along with a measure of playfulness. He returned home last spring, Dr. Kahanovitz by his side. Moments later, the boy was in the arms of his tearful grandfather. Last April, Dr. Kahanovitz was back in Armenia, along with the volunteer medical team he recruited. They took over 2 surgical floors of a hospital in Yerevan, Armenia's capital, and then they opened an outpatient clinic and worked longer hours.
But the infection is what makes her sick. And we clean the infection, and she will be able to get stronger.
Registered nurse Judy Donahue was one of the recruits. She has returned to Armenia 3 times.
It's hard to absorb what they've gone through, the magnitude of the suffering. It's like trying to absorb the Holocaust.
Frequent trips to Moscow brought Dr. Kahanovitz in contact with Stefan Vetrolay, chief of back surgery at the largest orthopedic hospital in the Soviet capital.
Dr. Vetrolay is probably just as good a surgeon as almost anyone that I've operated with here in the United States. But the thing which keeps him from attaining the same level of expertise that we do here is that he just is not afforded the technology that is available in the Western medical world.
In Dr. Kahanovitz's view, the difference comes down to basics.
We're not even talking about multi-million-dollar MRI machines. We're talking about a several $100 headlight or a $1,000 pair of magnifying loops. Well, I think what I would like to see happen has already started. Just the fact that we can go over to the Soviet Union now and operate with a Soviet physician, and he will probably do the same thing this summer when he comes to visit here, is a major advance, not only in medicine, but also in the relationship between our countries.
An advance recognized by the USSR a few weeks ago. There have been other special moments as well. Christmas Eve in Moscow 1 year ago, and an introduction to Mother Teresa.
She took my hand in hers and blessed me and said what a wonderful thing we were doing and wished me happiness and that the things that I wanted for Christmas would come true. And lo and behold, when I had gotten home, my wife and I, we've been trying to have our second child for about 3 or 4 years, was pregnant.
On the most recent return to Moscow, Dr. Kahanovitz was invited to Dr. Vetrolay's home. The first toast was not to East-West relations, nor was it to advances in science. It was from one friend to another, on the birth of a new baby.
We may consider it the most essential event in the last year.
I think it's not so much luck or fate, but I think that it gets back to if you want to do something that you think is meaningful enough, and you persist long enough, you can probably do it. And people keep asking me, why do I keep going back? Because you have to go back. If you don't, who will?
For Sunday Today, Ellen Fleischer, NBC News.